We are all so busy these days, and we're always looking for helpful tips and advice on how to find a better work-life balance. We all have to earn a living and pay the bills, but are you doing enough to look after yourself and your health at the same time? Now, many of us prioritise careers and work, and we're slaving over our computers and mobiles all the time. But does this make you cut corners on your diet, exercise or sleep? I'm Dr. Ben Sinclair, and welcome to Health versus Wealth with Dr. Ben. Our guests share their life experiences and we discuss their challenges in their health and their wealth. I hope their experiences will help you with your life and health. Today I'm joined by Dr. James Gill, and he is a colleague in Dr. Finlay's private practice, and he's also an associate professor at Warwick Medical School. James, welcome to the show.
Morning, Ben. How are you doing?
I'm all right, thank you. Good to see you. And now we are both GPs. Mm-hmm. John Sinclair, one of my forebears, was the grandfather of statistics, but I believe you're related to the father of surgery.
So a couple of years ago, one of our family members decided to do that who do you think you are thing. And there'd always been the sort of line that one of our grands was Granny Lister. And she actually followed it back, and our family does have, Scottish connections. And it turns out that I am distantly related to Joseph Lister. For those of you at home, he invented something called Lister's carbolic acid, basically the forebearer to antiseptics. So just that creation allowed us to do surgery without, the risks of our hands causing the infections that subsequently would go on to kill the patient.
Wow, that's a great heritage.
Well, I sometimes look at it the other way, though. It's like, because he was this fantastic surgeon, they always say that there is no healing without the steel of the scalpel. And then he must be a little bit disappointed in me as a GP, a bit of a pill pusher, not really doing anything with my hands. So
I see. But then, I think we work differently. We're more sort of people-orientated and broader, perhaps, than surgeons. Not to disrespect our fantastic surgical colleagues who have amazing skills. Now, we're both doctors. You're a GP for Dr. Finlay's private practice. You also work in the NHS, and you teach at the medical school as well. Mm-hmm. But did you always want to be a doctor?
I wanted to be a farmer. No, really. I am. My life is a series of failures upwards.
I like it.
I failed my A-levels, B's and C's. Didn't get into the course that I wanted to, and ended up, calling Nottingham University through clearing, and misdialed the phone, and somehow a phone picks up the phone and says, "Oh, yes, sure. Well, you've got a problem, haven't you? So come over to Sutton Bonnet and we'll have a chat with you and see if you like the animal science course." So, shot over to Nottingham to have a chat with this chap, and this bald chap with a very florid pink shirt sort of shows around. "Well, you seem a perfectly pleasant chap. Would you want to come on the animal science course? I love pigs, by the way." Okay, great, we'll go with that. Turned out somehow I'd accidentally dialed one of the professor's desks.
No.
He'd no idea what clearing was or anything like that, but seemed to like the cut of my jib, as he said, and gave me, space on the course. The problem was he didn't have the authority to do that.
Oh, no.
And caused some problems at the university, and they said, well, we can't rescind what he's done because he's the big head here. So welcome to farming land.
So you got into animal science by a mishap.
Mm-hmm. And then I spent 3 years living on a really small working campus outside Loughborough. Pigs, cows, cannabis, and literally, they did huge amounts of cannabis experiments there.
Okay.
Huge.
So research, not just
absolutely
smoking it.
Not at all. And to the degree that, they created an artificial sun there to look at what the effect of growing crops 24/7 in light would be.
Wow.
And we did all this fantastic stuff because essentially farming is about nutrition.
Yes.
And, we talked about fats and the effect on the body and glucose and how, the sugar issues cause diabetes and the problems. And whilst I loved it, all of this was bench science. And, it's fun dissecting a pig and all the rest of it, but I wasn't helping anybody. And that sort of got me to think, well, hold on, the stuff I enjoy is looking at how these fats and things impact on people and the body.
Okay.
I'm in the wrong line, so I applied to go to medical school and managed to keep on going since there.
Wow. So Warwick has played a fairly pivotal and central role in your life and career. Tell us about your associations with the town and the university there.
Well, Warwick was my medical school. It's a postgrad course, so that is its benefit in the sense it's only 4 years, but also it's so compressed, it's so very stressed because you've not got the time.
So quite intensive, and for people who've already done another degree.
Absolutely. So I'd already put 3 years into my first degree, another year into my master's. So I'm 4 years of not earning. So the whole idea of having, another 5 or 6 years, it is good that we have these graduate entry courses. Got through Warwick, failed my first year. Rowing is a big distraction.
I agree. I was the same. I failed my second year.
And my personal tutor at the time, this absolute firebrand, Professor Vinod Patel, had me crying away in his office, what am I going to do, failed and all the rest of it. And he basically just told me to pack it in, get back to work, which I did. Finished at Warwick and somehow kept him, in the loop there, and ended up working back at Warwick for an academic job and then an academic GP job. And then still working with this chap, Vinod Patel. And now, years and years later, here's my boss as the professor of clinical skills. I'm his one of his number twos. He's got two of us as his associate professor in it. Many days it feels like they forgot to ask me to leave.
So you're still hanging around?
Genuinely, for 2 years I worked at the medical school because no one said don't come back.
Maybe there's something about what you're doing that they liked and they actually wanted you to stay there,
Maybe.
And you have a particular interest in teaching. Tell us a bit more about that.
I am so proud of what we do. I do clinical skills, which is baseline year one medicine. Basically, how to hit people with stethoscopes. It's how to poke people. It's how to feel what goes on a stomach, how to move a leg, how to move a hip. It's the basics of how to be a doctor.
That's so important.
Absolutely. And I start that on week 2 of the course with these students. And it's fantastic to get them to, to see their eyes light up as they understand what they're listening to on the heart. But with a slight arrogance on my side, I think that clinical skills is the most important thing we do because it's how to work when the CT scanner's not working.
Absolutely.
It's how to say that guy's got a torn meniscus in his knee without putting them in the MRI scanner. I champion all of my students to be able to work when the power's out. That's what we do in clinical skills.
And I think that's why we probably work so well together, because I think history and examination is absolutely key. If we get those skills right, yes, we might have a confirmatory scan or a blood test, but actually those basics that our forebears used in very basic surroundings, and actually it's about scientific principles. It's about also curiosity. And I sense a strong curiosity emanating from you. I'm curious, why does this happen? Why is it that if you eat this, this happens or doesn't happen? And you've also got an interest in immunology, haven't you?
Well, that was my master's. I had a year to kill between finishing my animal science and getting to medical school. So I went and sort of looked at white blood cells. And off the back of that seemed to sort of just be very useful over COVID. And again, the medical school sort of having me as this unit of work would farm me out to Sky TV or ITV to talk about COVID and try and help people understand what was going on.
So, James, is it the case that you take your students back to basics at Warwick?
Well, they have to have a baseline knowledge, absolutely. And as I say, I'm there in week 2 starting that. But it also, that work that we do in week 2 directly helps the patients. So we had a patient recently who came in with a problem and they were asking for a scan. And my response to them was, we don't need a scan. I have the skills to examine you and say, this is your problem. If you want to pay for your private scan, I'm certainly not going to stand in your way. But we don't need that scan because we know what's going on. So rather, let's have you save that bit of money and go and see the consultant, the surgeon, who's going to help sort out your problem. Yes, the scans are useful. We investigate to change our management plan. With that guy, we knew what the answer was. Yes, we do the scan, it confirms things, but we don't need it. So we can go straight to see the surgeon, who can also assess him and say, this is a simple operation. Let's go forwards.
And I mean, you're an associate professor. I know you have a much wider reach, teaching clinical skills, which is your absolute core skill for students. Tell us a bit more about your teaching on a global scale of clinical skills.
Well, because it's so fundamental to what we do with any form of medicine, it translates everywhere. So when we've been, working in Tanzania, we've had the opportunity to help some of the nurses brush up on their clinical skills and understand that, the different sounds that they might get with their stethoscope might indicate one thing versus another, whether or not we're looking at an infection or perhaps that person's got a collapsed lung. We are able to make these skills easily transferable. So we have, quite substantial YouTube channel, again, helping people to understand what's going on. Now, I say people there because it's not just the students. We've had fantastic stories where we did a video on how to do a breast examination, essentially for students. But somebody saw that video, did the examination on themselves, found a lump, and then went to see their doctor, which confirmed it was cancer. And they came and put the comment on those videos. Wow. So if we hadn't done that, they said they wouldn't have checked in the right way and found that lump earlier. So everybody has a relationship with clinical skills, even if they don't understand it, because we have our bodies.
I think, the self-examination stuff is fantastic because it's empowering people to do this, maybe in places where they may not have access to a doctor or healthcare professional. They can see you on YouTube, examine themselves, and gain extra information and knowledge. And medicine is not exclusive to doctors. It's so broad, and empowerment these days is so important. It's lovely to see that you're reaching so many millions of people with good, reliable, safe knowledge and practice.
Well, I love driving. Driving's fantastic. The sound of the engine, the feel of the tyres as you're going around a really good corner. It's the same thing with the human body. We have these fantastic machines that we get to live in all the while. And if I can explain to somebody that if your body can do this, maybe you should have a chat to somebody about it, because that might not be normal. They might have just thought that was what they had anyway. So, some people are sometimes a little bit bendier than others, and they sometimes find that their knees hurt a little bit more. I want to know about that person because actually maybe we need to help them with physiotherapy to strengthen their muscles and prevent joint degeneration over time. We can help by putting that information out there.
Very interesting. We both actually didn't get the grades to get into medical school or university the first time. We both described that as failure, even though we actually got passes of C and above. And we both also failed a year of medical school. What this suggests is that actually failure is the teacher. But if in the long COVID setting, we're actually able to achieve a goal, our hope is that through our investigations and research and thinking, with two heads better than one, we actually in time will get the evidence and the research there to help people with the bits of their system that we still don't yet understand. And there's so much we don't know about long COVID, but we're drilling into it all the time and working with international experts around the world that I, as an eternal optimist, do hope that we will be able to get people back to full health, but it takes time. And we've both been affected by long COVID. I had severe neurological side effects with sort of left-sided stroke-like presentation. I know you have a passion for exercise, as I do, and your performance was affected. Mm-hmm. Tell us more about how you were affected by COVID and then your performance.
Well, again, this is the astonishing thing about long COVID. Some people's lives are completely destroyed by long COVID, and other people, like myself, were more mildly inconvenienced by it. With my COVID, when I had it, I had scans of my heart and lungs because we thought we got, a big clot there. Thankfully, there wasn't anything. But I feel that I've been affected by the microclots. And I used to, do 10K in an evening just for fits and giggles.
Just for fun.
Yeah. And it's taken me such a long time to be able to get back to being able to get a 10K run in. I have to be really careful now not to push myself too much. If I run, I can do the 10K, but if I go too fast, then I find I am short of breath for the rest of the day. It's like I'm not able to get enough oxygen around my system, which for me, again, goes back to the whole microclot theory.
Absolutely.
I mean, I said that I had scans for a potential blood clot. Again, highlighting that we don't have a plan for COVID yet. When I had this, I was having difficulty speaking, and, doctors, mates rates, I called up a cardiologist and said, I think I've got a blood clot here, help.
Yeah.
Right, don't worry, James, we'll get you a scan in a couple of days' time. Here are the injectable blood thinners whilst you're waiting for the scan. Started those, a couple of days later, all of my symptoms improved.
Now, I wish I'd had that option. And when I had my suspected left-sided stroke, because I said, I'm having difficulty speaking and walking and moving my left arm and my left leg. And my GP said, look, we'll get you a scan. But interestingly enough, didn't fully examine me, didn't do all my sort of reflexes and things.
See, clinical skills.
I know,
skills.
I was so confused and exhausted at the time. I was trying to say, please just examine my reflexes. I think there might be something here. And but we didn't know about microclotting in those days. I accidentally tried ginkgo biloba at the time because I'd found that beneficial for performance in the past. I now know it had helped me at the time because it's a mild blood thinner. So actually, we stumble across these things through experimenting, and a lot of the experimentation has been on ourselves. Now, you've had this interest in sports. You've done Tough Mudders. I know you're a triathlete. Your handle is Titanium Geek. So you're a titanium man. This has led you to end up with this sports and performance interest funneled into the Speeds Clinic with Dr. Finlay. Can you tell us a bit more about Speeds?
Well, yeah, I'm really proud of Speeds, if only just for the acronym. So Speeds is strength, performance, exercise, diet, and sleep. And actually, I almost think that sleep is probably the most important part of that, because most people who want to do sports, they run, they're short of breath, they've done a good thing. They're eating they're eating what they think is a good diet, and they're caffeinating throughout the day because they're working hard. They are, running a family, they're doing their job, they're running their business, they're doing the weekend warrior, and they're getting 4 hours sleep. Sleep is not just when the body switches off. It is conserved across the entirety of life. I didn't say the animal kingdom, life. Bacteria go through sleep cycles.
Oh, I didn't know that.
Yeah, something that is conserved to this level from an evolutionary standpoint must be crucial. And it is.
It must be important. I know you're passionate about these things. How do you help people in the Speeds Clinic with their sleep?
So part of it is monitoring. As a scientist, before I went to medical school, I need data. And so there are wearables that we can use to look at sleep. I'll be honest, some of them are better than others, and none of them are as good as going into a sleep clinic. So if someone is really struggling with their sleep, we're thinking pathologically so, then we'll put them in a sleep clinic. We will record their brain waves and work out what's going on and how to improve things. Sometimes that might be there's actually a problem, not with the brain, but their breathing. Maybe they have put on a lot of muscle, it's not just fat, but they've put on a lot of weight, so it's affecting their breathing. We might be able to look at breathing exercises with that. But even if they don't want to go through that, we can still use wearables at home to get a rough idea.
It's an indicator, isn't it? And we're both wearing, Garmin sports watches from our triathlon interest. I've got an Oura ring, and I think you're wearing. I'm
bilateral today. I've got a Whoop and Garmin on.
So you've got a Whoop and Garmin, and we're probably a bit geeky with this, but it does give us data, and a bit like the scan, with medicine. We look at the history, we look at the person, and then we look at the data to sort of confirm or to give us further insight. I know you've got interest in nutrition as well, and how does nutrition fit into Speeds?
So something that's actually quite common is something called REDS, Relative Energy Deficiency Syndrome, where you can have somebody who's eating 2,500 calories a day. They're eating more than they think that they should, but for their work, for their life, for their exercise, they actually might not be fueling properly. So although they're eating more than, say, everybody else in the household is, they've still got more of an energy burn than they're expecting. Because even if their Garmin has said you've burned 800 calories on this, you've still got to do the repair to the muscles, the rebuilding, the growth hormone. And we can get people getting progressively tireder and tireder and weaker, and then their performance gets affected because they're not fueling properly. And we get this, as I say, relative energy deficiency syndrome, and it affects their entire lives. They become depressed, they become slow, they become irritable at home, their performance is all impacted. Yet when they look at what they're doing, they think they're doing everything right, because they are, but they're not looking at the whole picture, they're looking at the individual components of the picture.
I love that you have this overview of all the inputs into good health and performance, and it's lovely to see all those things woven into your practice and speeds. Now, talking of physical things, we both enjoy climbing mountains. You've done Kilimanjaro and you've been to Basecamp at Everest, which I'm quite jealous of. I haven't done that one yet. What about your biggest challenge, which was the island?
So as with everything, again, failing upwards, I ended up on Bear Grylls, the island, because I accidentally filled in the wrong form. It's
There's
the
a lot
long
of
story
accidents
short
happening to you to result in interesting outcomes, aren't there?
Well, I only got involved in sports clinics because I shattered my elbow.
There we go. And we met over a patient with long COVID, and you accidentally got into medical school and university. So tell us about the island. I mean, I know you lost a ton of weight.
I lost 14 kilos in 5 weeks.
Wow, 14 kilos in 5 weeks.
And so this kind of relates to the sports clinic. I was unwell off after that.
Right.
I looked like I had been starving, but also my energy metabolism was, technical term, shafted. I was so ravenously hungry. I could eat 2 large Domino's pizzas back to back, my stomach distended and painful, and still wanted to eat more because my leptin systems were just so far out of whack. My body stores were broken.
And this was starvation, presumably, almost?
Yes.
And malnutrition.
So with a lot of reality TV, working in reality TV, there's a considerable amount of editing going on. Bear Grylls, the island, is honestly what you see in terms of the endurance. Yeah, there's still editing for a show, but you are dropped off 200 metres from the coast with 2 knives, 2 machetes, 1 change of clothes, 2 radios and the cameras, because you're doing your own filming as well.
Wow. Okay.
And then they pick you up 5 weeks later.
Wow. So it's intense. And I heard that Bear was actually genuine in real life as he comes across. Can you tell us a story about your interactions with Bear?
So, because there's a show to be filmed, the producers have their tick sheets that have to be done, and we're told roughly what's going on. So the day of wrapping, the day that we get to go home and get to eat again, we knew that they were going to come in, but they were delayed by 12 hours.
Oh my goodness. So you're sat there desperate for food, starved, lost 14 kilos, and wow, what happened then?
So the boats come in, all the producers, the cameramen, like something like D-Day landings, all the cameramen come off, and they said, right, we've got 5-6 hours worth of filming. But there's food on the boats. Can we just have a snack first? No, we need to do this now. Fine. So we do 3-4 hours of filming, and we are literally going over sideways. And Bear says, can we wrap up now? These guys are hungry. Producers say, no, we've still got to hit our things. And he looks for a bit and says, well, actually, I'm quite hungry. And we're like, yes, we know. Well, I've got a speedboat, and I'm the only one that can drive it, so I'm going to get lunch. Would anybody like to go on my speedboat too? The producers were not happy with him. We all pegged it onto the speedboat.
Everyone piled onto the speedboat.
Yes.
I love it. Now, you've done some fascinating things. You're a busy working guy, like a lot of our guests. Some of our guests are working too hard. For yourself, you're into sleep and performance. What's your working hours like, and your sleep and your nutrition?
Oh, I'm a doctor. Do as I say, not as I do.
Okay, so is it junk food all the way? What are we talking about here?
So what I mean by that is I am currently working, honestly, I'm probably working about 10% harder than I should be doing. There is a reason for that. I'm very lucky. I've just acquired a small human. I have a new son at home.
So you didn't steal him, you actually you created him. Fantastic.
Well, I occasionally steal him from my wife, much to her chagrin. She wants to hold him all the while, but she has to share. So I'm intentionally working hard this year whilst he is sort of just a unit of work rather than a person. And when I become somebody that he recognises, when I matter to him as a person, I will scale back and I will focus on the quality of my life, not the quantity of my work.
It's a very interesting approach. I actually, I've got 3 kids, and I would say I sort of bonded with them more and more as I went on. I think they're aware of you right from the beginning, even in the womb. My daughter used to high-five me in the womb when I talked to her.
Wow.
So I think that he's already aware of you. So I'd encourage you, as we've talked about, to balance time with little people. We never know what influence we're having on them. And but you're a busy man, so tell us about your sleep. Are you managing to get this desired sort of quality and quantity of sleep with a newborn? Are you sleeping in the back room? How's it working?
It depends on what I'm doing with regard to work. Some days, depending on what the clinic is, I will sleep in the guest room because sleep is so important to cognitive function. I have a job where people trust me to look after them. I can't phone that in. So some days the sleep gets the number one priority, and that impacts on other bits of my life. Some days we will, because we'll know we'll be woken up by Felix and this, we go to bed at 8 o'clock some days in order to get the 7 to 8 hours, in order to mean that I've been restored, that my memories have been pushed deeper in my head so I can remember the long COVID paper that I've read that morning.
And James has an encyclopedic knowledge of long COVID papers. I keep sending them to them to sort of cogitate. Now, whenever I see you, you're always trying to get fruit and veg into you. Tell us a bit about your nutrition.
Well, the thing is, the whole 5 fruit and veg a day was actually a PR thing that probably is a bit of a lie. We should be aiming for 10 in the day, but we didn't think they could sell it.
Okay.
There's a better way of looking at it, that rather than getting 5 a day, because you could eat 5 apples every single day, you're better to have 30 different fruit and veg across the week.
Oh, I like it. So variety, but spread across the week, not pile in 10 oranges.
Absolutely. So I have just a sheet on my phone where I'm ticking, right, how many do I get? And I target that. And sometimes it's a case of that I will do it at my desk. So I will go to the supermarket opposite and I'll pick up raspberries, blueberries and some cherries. And it's right, I have got 3 there that I will munch during the course of my clinic.
And I can confirm you arrived with a bag of cherries today. So finally, James, you like junk food, pizza or fish and chips?
Both, but if I'm not doing well at home and life, I'll go with the fish and chips. The reason being is it's the healthier of the two. Think about what you're getting. You're getting potatoes that somebody has sliced. There's a little bit of batter there. There's a little bit of oil, and you're getting cod, haddock. You're getting good protein. If I go and have a pizza, then I'm dealing with probably, a ultra-processed dough, ultra-processed cheese, ultra-processed sauce. So I'm trying to make sure I'm getting better quality food for my fast food when I do have it.
So if you're going to have it, go for better quality fast food.
Always.
I love that tip. James, we've run out of time today, but it's been so interesting just drilling into your knowledge and your story. I want to thank you for coming on the show today, and that's all we've got time for today, but we look forward to you joining us for more episodes of Health versus Wealth with Dr. Ben. So that's it for today. I hope my guest and I have helped you meet some of your health versus wealth challenges. Now, to hear more from me, Dr. Ben, why not subscribe on your usual podcast platform? And if you like my advice or you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. Anyway, I hope to see you again, but for now, it's goodbye from me, Dr. Ben.